Hi, my name is Dr. Jess Benjamin, physician at Shift and certified menopause provider. I grew up in the world of medicine and healthcare, as both of my parents were doctors, and I think I've always been interested and fascinated by the human body, how it works, when it doesn't work, and so medicine was kind of the natural path for me. When I was in medical school, I was kind of interested in everything. I didn't really want to get locked down to any one organ system per se. I wanted to treat the whole person, the whole body. So primary care really was the perfect fit. I think the first thing I'd love for a new member to know about me is that I am approachable and I'm here to care for you and I'm on your side. I want patients to feel like they are confident and trusting in the care that I'm providing, in the communication that we have, in the relationship that we're building. The first time I sit down with a new member, that first encounter is really about building a relationship. So I spend a lot of time getting to know you as a person. I want to know what your goals are, where your strengths are, where you struggle, and to really understand fully, where you're coming in with. I would take a full assessment of current concerns, medical concerns, where you are, how we can approach them. We also utilize a lot of advanced diagnostics to get a full picture of somebody's health outside of just what are the symptoms they're experiencing, what do their labs look like, what medications are they on, because health really encompasses so much more than that. And then we do a lot of walking through how do we want to approach your healthcare. What do we need to do to approach current symptoms and issues that you're experiencing, but also how do we better your life in a number of ways? I want you to feel that you can trust me to provide the best care, and so we build that relationship, and that really starts with that first encounter. I think it's important to view health as more than a lack of disease, something to be feared, but really we can see health as our greatest asset. Some of these lifestyle measures and habits will center around exercise and movement, diet and the way that we fuel our bodies, how well we sleep, and also stress management. I work alongside our physical therapists and our registered dietitians to support each of our patients in their health care. Concierge medicine allows us the time and the space to really dig deep on somebody's health. I can see patients when they need to come in, get them in the same day, the next day. Here at Shift, we also want to focus on a proactive approach to healthcare. And what this means is looking at health where it is now, where we want it to be, and the things that we can do in our lives to really achieve the successful outcomes that we are looking for down the road. I want to educate my patients that the ways that they live their lives now, through diet, through exercise, through optimizing sleep, through their stress management, through how they socialize with other people, how that can really optimize their living for the duration of their lives. Women in midlife, in their 40s, in their 50s, going through perimenopause, menopause, are left with a lot of confusion and misinformation. Women don't know where to turn. They turn to their friends, they turn to their family members, sometimes they turn to their doctors, oftentimes they'll turn to social media. There's a lot of conflicting information, and women, frankly, are confused. I want to be a sound of reason, grounded in evidence and science and data, to provide women the care that they need to help them through this difficult transition in their lives. Whenever I sit down with someone, whether it's a woman in midlife, again, perimenopause or menopause, or someone else navigating a difficult transition in their life, first I want to understand where somebody is. I want to hear their concerns, validate their concerns, and then I want to educate them around the medical space, the data, the science about how best to manage some of the issues that they may be dealing with. And then together we come up with a plan that feels right for the individual patient so that they feel empowered and confident in the plan moving forward.